Before, I looked like a very unapproachable person, probably because I wouldn't smile. I will walk around with a smile on my face before and show you my teeth, where before I wouldn't. So I'm Tammy. I'm from the Colony, Texas, and I had my upper arch done by Dr. Johnny. Early in age, I was diagnosed as being a perio patient, a periodontal disease. I didn't have any missing or really discolored other than just needing to be cleaned, but they were all mobile to the point where I probably would have lost them in the next, 2 years anyway. It was getting worse. You have bleeding with periodontal disease, so you can see that too. There was some discomfort, but not unbearable, right? But a lot of it was just the point that I'm in dental, and the more I, grow in my career, I'm in front of people. I just wanted to be happy with my smile. I caught myself not smiling whenever I should. I would smile with my mouth closed because, my teeth weren't as white as I wanted them to be. I was at the point where, nobody would clean my teeth because, it was the perio disease was so bad. My teeth were mobile. It was down to we could try to, do the cleaning, a deep cleaning down into the gums, but that may or may not give you your teeth for, the next 2 years, or this is the other option. So I went with plan B and, because I didn't want to go through the deep cleaning and have it not work and end up here anyway. I had met a couple different dentists, that would look and give me the same diagnosis as what Dr. Johnny did. In being in dental, right, you can tell just by personalities and things who's going to take the time to explain things to you. Dr. Johnny dummies it down for you. That's why I went with him, is because he's personable and you can tell that he loves what he does. So of course, I met with him the first time. He did an extensive exam, agreed that my teeth were mobile, and then he told me basically, what it was going to look like after, if I was going to, of course I'd be asleep during the whole procedure, and that I would have minimal pain. I took ibuprofen. It was easier than he even made it sound, right? But he went through all the steps and told me that he was going to be there, and even called to check up on me, later that day and the next day. I wanted them to be whiter, so whenever I smile, they kind of stand out because it's your signature, right? And even all the way down to the day that they delivered, there was one of them, I was like, is the eye tooth off a little bit, and we tweaked it and made it fit. They were, you pick the color, the shade, and everything, even the shape, down to the shape. And they give you their opinion, but ultimately it's up to you, so I had the choice in all of it. So I wanted the option to perform self-care instead of needing to go to the dentist, that way I could take care of it as I needed to. Having the removable would just be easier. It's less trips to the dentist, If you get that permanent one, then you have to go actually have them remove it to keep it clean. And with my schedule, that isn't really in the cards for me, to go quite often to get it cleaned. So that's why we went the direction we did. So the experience number one has, of course, I've lost weight, my smile is 100% different now than it was before. I just feel better. I feel more comfortable and confident in anything that I do, where before, not so much. Don't think that there's not another option, right? I mean, a lot of us will say, oh, I can't afford it, or I don't like the dentist is probably the biggest thing, or the fear, right, stops you in your head because you just don't know what you don't know. And there's only one way to really know, right, and to understand. And a lot of us have that theory that a doctor's only going to tell us what they know, and we're not going to understand it even at the end, right? And like I said, Dr. Johnny will tell you exactly what the options are. He'll make you comfortable, and you'll know that he's in it to help you and not to just treat you like another patient walking through the door. He's going to take his time, and he honestly cares.